Hi, this is Ryan McGee from Cabarrus Health Alliance with the COVID-19 update from July 29th. Thank you for joining us. I'm going to use our website to walk through two different issues today. First, we'll discuss the governor's executive order that takes effect on Friday, and then we'll discuss the current situation for COVID-19 in Cabarrus County. So, as you may have noticed while I was talking, we have a banner on the front page. We actually have two banners, but one of them takes you to our COVID-19 page. So if you come to our website, cabarrushealth.org, you can either wait until you see that banner for COVID-19, or you can click a little arrow to make the banner change, and then just click on this banner, and it will take you to the COVID-19 page. We update this on a regular basis to try and bring you the best information we can, depending on your situation. So, first, for the governor's order, we have a link to executive orders. If we scroll down the page, about halfway, state executive order information. This will take you to the state's website where they have the latest information about executive orders. So, as I mentioned, the governor signed a new executive order. It takes effect Friday, and it says that there's no alcohol served between 11 p.m. and 7 a.m., and this goes for restaurants and bars alike. There will be no alcohol sales between 11 p.m. and 7 a.m. And again, this is to limit the spread of COVID-19. So back to the same page, we have links right at the top for COVID-19 data, and I'll point out we have the exact same information on a Spanish language page and an English language page. So we're going to go ahead and click on the English language page. And the very first thing we have on the page after you scroll down a little bit is our scorecard. And the big thing I want to point out is that we have changed the light next to hospitalizations to red. We have now gotten to the point where our hospital resources are being greatly taxed. This is now critical. So this is the biggest change today. We're going to scroll down just a little bit. And as I've mentioned on previous videos, some of the data is delayed on our cases dashboard, and this updates multiple times per day. I expect that this later end of the dashboard will pick up as some of the delayed test results make it to us. But as you can see, we've had a fairly high sustained number of cases for weeks in a row now. And as people continue to get infected week after week, there's a delay. So first there's a delay from when they first get exposed to coronavirus to when they go get testing. There's also a delay till it takes people to get sick. And some of those people need to be hospitalized. So if we scroll down just a little bit, we can see that for the last several weeks, the last few weeks here, we have had an increase in hospitalizations in the county, and that has increased dramatically this week. So over time, as more and more people are getting sick, some of those people need to be hospitalized, and we are now really taxing those hospital resources. So it's very important that we stop the spread. And one more thing that if we'll go back up to that last dashboard, and again, this dashboard updates several times a day. The hospitalized dashboard updates at least just once per day. But what I want to share is that we've had 3 deaths this week in Cabarrus County due to COVID-19. So just as there's a delay in when people first get exposed and get sick with coronavirus, there's a delay in terms of people who get sick enough to need hospitalization. And several weeks later, there could be another delay between those hospitalizations and people who eventually die from coronavirus. So we are thankful that relative to some areas in the state and in the country, our numbers of deaths are relatively low. But we would like to prevent any further coronavirus deaths in Cabarrus County. So we absolutely need to stop the spread of coronavirus. Thank you for all the things you're doing to do that.